Okay. Next to your med room is going to be the patient assessment cart. And again, this is on wheels, so you can take it with you into the patient's room. But everything that you're going to need to assess the patient is in here. Okay, so you have a stethoscope, you have a thermometer, you have a blood pressure cuff, you have the blood glucose monitor in here, and I think that's it. And so we're going to take it into the patient's room. All right. And when we are doing the assessments on the patient, we want you to actually, could we move it over here a little bit? There we go. We want you to actually assess the patient so that you are getting the heart rate and the respiratory rate, you're listening to the lung sound, stuff like that. When you are going to do a apical heart rate, we want you to actually go through your landmarks. We want you to tell us where you're feeling and what you're looking for and the whole 9 yards. And then you will look for a spot on the mannequin, on the simulator, and typically different simulators have different areas, but you'll see an X marks a spot, and we will go through this in orientation as well. But where you see X's drawn on the simulators, that is where the speakers are, so that you can hear the apical heart tones the best. All right, that is where you're going to put your stethoscope bell so that you can hear, so that you can count for 1 full minute. We also want you to make sure that you come to SimLab with a watch on so that you can actually count what you're listening to. When you are doing lung sounds, we want you to listen to the front, and then you could say to me, sim question, if I was to listen to the posterior lung sounds, what do I hear? And then we would tell you, because we don't want you to move the simulator around too much. When you're doing blood pressure, you're going to grab the blood pressure cuff, and you're just going to put it on the simulator. So I'm basically going to put this on the simulator. Sim question, can I get a blood pressure? And then we'll give you the blood pressure. If you are going to get a temperature, we are going to, sir, I need to get your temperature. I'm going to get a temperature. I'm going to put the thermometer in the simulator's mouth. Sim question, can I get a temperature? We will give you the temperature. For your blood glucose, when you do your blood glucose, you're basically just going to open it up, and I want you just to verbalize your motions of what you're going to do to get a sample of blood to check the blood sugar. That's all you're going to do. You're not actually going to stick the simulator or anything like that. You're just going to verbalize and go through the motions of what you would do to be able to do that, and then we will go from there, and I will give you the value. When you are going to do the pulse oximetry, you are going to take it out of your cart and you're going to put it on the patient's finger, and you're going to say, sim question, can I get the pulse oximetry for the patient, the SpO2? And we will give it to you. All right? Remember that your bed goes up and down, so you can move it. All right? So everything is going to go up and down, and you can move the head of the bed up like this. All right? All we ask is that sometimes our simulators are plugged into the walls right here. So if he's plugged in and you pull too high, you might unplug him, and then we're going to have a code, and we don't want that. Usually everything on the wall is going to be running and working, and we will go over that next.